gosh, can I just go somewhere without, having to discuss my skin colour and where I'm from and stuff like that.
Must have come from abroad, you must have done something else before you came here. And they would question, and they wouldn't question my clinical partner, who was a white male, even though we're wearing the same scrubs and we're doing the same things.
I think racism kills people.
I just feel like nobody cares and nothing has changed.
Racism is unfortunately embedded in NHS and in your daily life.
It can be as blatant as somebody saying to me, one of the problems with the medical UK healthcare system is that there are too many Asian medical students. Now, when somebody says that, that's pretty blatant racism, but they were pretty emboldened to say that, right?
When I was a third year student, I was on the wards with another student and we were asked to help with a bedside procedure that we've been trained to do. And just because of the patient's position, I kind of knelt down to the level of the patient's arm, and the patient said to me, "I don't like Muslims and I like seeing you on the ground like that on your knees in front of me."
I have a condition called sickle cell anemia. And when I was 9 years old, I caught the parvovirus. And usually a lot of kids catch this virus and they're completely fine. But if someone with sickle cell catches it, it can make them really sick. And for me, it did that. So my mum, who is actually a nurse, took me to the hospital. She took me to the local one around my area. It was a predominantly white area. And when I got to the hospital, they didn't check my blood. They didn't check anything. And they sent me home and they said I was completely fine. When I got home, I was completely unresponsive. And my mum, I remember her saying, "My child will not sleep in my house like this." So she drove me like 30 minutes away to another hospital. And when I got there, they did check my blood and my hemoglobin was so low that the doctor said I wouldn't have survived the night if I didn't make it to the hospital. I think a lot of people will hear this story and think that it was just negligence, but having learned about how we're supposed to respond to children that are very unwell, I know that this was because my mum was black and because they didn't understand the condition. It makes me feel disappointed that my mother could have potentially lost a child simply because of the colour of her skin.
It started when I had to go to A&E. I told the doctor I was fatigued, I was having so much headaches, I was having palpitations, I was having diarrhea. I knew that was getting to the point where things gonna get worse. And the doctor kind of dismissed it as, "You might be having food poisoning." And she looked at me that I'm Asian, and she said to me, "You might want to heat up your rice a bit better," and said I should go home and rest. And after that, things have gotten worse. We went to the GP. The doctor referred me to oncology right away because they were worried I have cancer. Can you believe this? That they dismissed me, that I am actually fine a few weeks ago. And then the doctors here thought that I'm not.
The definition is the collective failure of an organization to provide an appropriate and professional service to people because of their color, culture, or ethnic origin. It can be seen or detected in processes, attitudes, and behavior that amount to discrimination through prejudice, ignorance, thoughtlessness, and racist stereotyping, which disadvantage minority ethnic people. When a patient comes in and with a parent, as they did, and said, I don't want my daughter looked after by Packies. And then the clinical director said, okay, but because of the rare nature of this child's disease, we better agree with the idea that they will only be looked after by white pediatricians. His decision was fundamentally racist. Was this a bad apple? Well, you could argue that. But actually, was it institutional racism? I would argue it was. And the reason I say that is that decision that was allowed in the governance of that organization had a huge impact on anybody that was white, black, or brown. Because what it meant was that the organization, through its leadership, had allowed a patient to be cared for based on racist decisions, which meant that because I was brown, or because my colleague is black, or of any other ethnic minority origin that was visible, they weren't allowed near the child.
So this is very clearly described by Roger Klein as a snow white peak effect. As a human tendency, you would like to hang around with the people who looks like you, talk like you, and think like you. And that's very clear in top level of NHS leadership. So consciously or unconsciously, you will hire those people who exactly I describe. And then you create what we call as a snow white peak effect, because everyone on the top layer is white and everything underlying is people of color.
You know, in the cases of research being primarily done on like white bodies. And then when these management strategies and therapies are implemented and it's not effective on the BME populations, it's not the fault of the therapy, it's the fault of our bodies.
Is everyday incident which hurts. Very minor incidents about making assumption of your color or your country of origin, classical question where you come from. And there's a lot of reason people ask that question, and not all the time is related to racism. And the very simple question like Brexit happened, when you're going to go home, when you're going to go back, or after the ward round you hear, they don't look like doctor, I don't know who make them doctor.
It's small things like, well, they don't feel small when they're happening, but when you see a patient and they think you're the nurse, or when people can't be bothered to learn my name or spell my name incorrectly or tell me, I'll never remember your name. And it's things like that that just make me feel really sad that I'm being probably treated differently because of the color of my skin.
In 2020, when I was actually working in a tertiary center hospital alongside many other colleagues, the majority of which were British-born, white medical students, I remember for lunch actually, I was sitting down with two other colleagues and I was speaking to them, and one of them actually asked me why I speak so ghetto. I think in that moment I kind of froze a bit and I was quite shocked. I didn't really know how to respond.
When I was at my GP placement and at the end of my block, my main good comment was that I spoke very good English, and there was nothing else on to do with my clinical skills or to do with anything else. It was mainly just I spoke very good English despite me growing up here.
Whilst during medical school, I was actually on an oncology placement. The consultant goes on to ask me, oh, so why is it you decided to do medicine instead of going into hospitality? What do you really respond? What do you really say to that? And I think what was most shocking about it was, I mean, he thought it was a normal comment to make. He didn't apologize thereafter. We just went about our day with me being effectively attacked and he effectively not being aware of it.
It just made me feel really frustrated because I felt like no matter what you did, it would still be, that's all they would see. about you. That's the first thing, and that would be the assumption they will hold on to despite what you say.
Whether we like it or not, every small or microaggression, and I argue whether it's a micro or not, lead an impact on you. And it happens every day.
Disappointed.
Anger.
Sad.
Inferior.
Inadequate.
Frustrated.
Unequal.
Worthless.
Teaching people more about microaggressions. A lot of people believe that coming up to you and saying, by the way, I'm not racist, I love your exotic skin colour, or pointing out your hair and, you know, doing stuff like that kind of gives you a badge of I'm not racist, but it's actually a microaggression because you're not able to, you know, just do your job because you're constantly being reminded that you're a different skin colour, you're a different race, you're from a different country.
We need to diversify medical education and provide resources that include all people of colour, like the Mind the Gap textbook or the Brown Skin Matters Instagram. This is so that what we learn is inclusive of the diverse patient population in the UK and that no individual's care is compromised.
So DJHM is our Equality, Diversity and Inclusion group. We work on promoting gender equality, LGBTQ plus equality and other forms. But one of the things we're working on a lot recently is anti-racism actions within the schools. So we've instigated a number of other committees within the school. So this includes our Decolonising the Curriculum Network with the Raising Concerns of Discrimination group and the Professionalism group.
Decolonising the Curriculum is an initiative aiming to dismantle systems of power that underpin contemporary learning. It's just a space for students to actually give us some feedback on gaps they are seeing in the curriculum or terminology that we've seen that we're not exactly comfortable with or where we can see improvements to be made. These sort of open, honest conversations in a safe place where like-minded students and staff are working together to improve these things.
The idea of creating a network within the university and students where they can raise concerns about anything, experiences, you know, that have happened to them to do with racism, also any discrimination, you know, homophobia or sexism, and creating channels that they can go through where their voice can be heard.
And this is, again, starting to look at how we work with our placement partners to try and create more professional environments to make sure that they're actively promoting anti-racist actions. So all of these different actions together are starting to try and create a system of actions that are hopefully going to support our Black, Asian and minority ethnic students. You're going to provide opportunities to have a safer environment, both within the school and within placement, and to make sure our curriculum is teaching things that they're accessible to everybody and reflects everyone's life experiences.
By empowering staff and student collaboration, the Midlands Racial Equality in Medicine Network aims to unite institutions across the Midlands to tackle racial inequality within medicine. We currently have gained commitment from the University of Birmingham, the University of Keele, Leicester, Lincoln, Nottingham, and the University of Warwick.
Far too often there is a top-down approach when we look at policy implementation. So you have people who are culturally removed, right, from what is actually taking place at the ground level, and they're implementing things that are either not working or grossly detrimental to, patients' health and health outcomes. So I think the first place to start is really to have focus groups and bring everyone into this decision-making process. I think if you have more patient empowerment and they have more of a say in terms of what works for them, then I think that is the first step we can have in actually dismantling racism.
Working with communities, getting staff who understand culture, communities, race, religious aspects of a certain group of people, so that we're not making assumptions, so that we're working within communities.
There need to be active recruitment processes on a senior position of people of color and female to bring that kind of diversification. So unless there's an active diversification of top layer, you would not like to see any change.
Staff don't feel confident to challenge or to raise a concern easily on the issue of racism. It's a very difficult, highly emotive issue. What you really need to address the challenges of racism is a governance framework that is one that allows staff to confidently and easily report issues of racism that are about language and behavior.
Things like workshops on being a bystander, being an ally, what to do when you see racism happening in the workplace. And I think things like that are also really important because people need to feel empowered and know what to do when they see or experience racism happening.
There is a problem with wrong side surgery. What do? You report it, you undertake an investigation, you then set out some learning, and you change the system and process, and then you wait to see if that implementation change has worked, either through an audit or some other quality improvement measurement process. That's how you do it today for those events. I don't see why it's any different or should be any different for issues of racism. You should have the same approach, but staff need the confidence right at the office to say, I'm going to report this because if I don't report it, I don't think anything will change.
The advice I'd give to someone that's experienced racism is that their experience is real and how they feel is valid.
Shout it out. Call it out. Don't live with it because it's not fair. Make a big noise. There are people who are going to help you. There are organizations which are going to help you.
Stand up tall. It's okay to be who you are. And remember, you're great.